From the aspect of, ladies, have talked to us a little bit about their concern for the development of breast lumps and bumps or mass and cysts, ductal obstructions and calcifications and the scarring of fat necrosis. These things can occur, following, fat transfer to the breast, and they can occur really following any breast procedure. The incidence in patients who have never had any other breast procedure is about 6 to 8%. That's what the studies are going to say. When you've had other breast procedures, and a lot of our patients have had explant, it puts them in a category where the studies say it's about a 17 to 23% chance that something like this is going to occur. Now, when it comes to treatment of this, I can tell you most frequently the findings are a cyst. All right, cysts can be drained. For our patients who are out of state or international, a breast center can drain the cyst. All right. Basically, a lot of cysts aren't really even addressed by breast centers because they feel it's inconsequential. When they have some findings of some of the smaller cysts, they're not concerned about it. If you want the cyst drained, you probably would have to specifically request it of them. And a lot of times they also, as I said, are capable of treating anything else that's underlying the breast center itself. Now, we do have patients who come back to us for a day trip, a nice follow-up. If they have any findings, we have a handheld ultrasound here. We can place it on there. If there's a cyst that we see, we drain it. So you can address it in one of two ways. Now, the other things get evaluated the same way you would as if anything appeared now. If you say you've never had surgery, if you've got a breast lump or a bump up here, you get to a breast center and they do what they feel is necessary. A mammogram, an ultrasound, an MRI, a needle biopsy. It's something that they need to evaluate it to make sure you're not dealing with a cancer. You're not at an increased risk for breast cancer following fat transfer to the breast, but you don't ignore some findings. You basically get to the breast center and rule out the chance you're dealing with a cancer. Now, as far as addressing those issues, you may feel some lumps or bumps or cysts or something in the early part of the postoperative course. I still want you to go the 3 months, that 3-month period of time where cells are really establishing permanence. You don't need to address anything. Following the 3 months, though, after your 3-month period of time, in the postoperative course, you can go to massaging certain areas like this. A lot of times they will resolve. You'll find that a lot of the ladies will develop a breast lump or a bump or a mass or cyst in the early process, but with a little bit of massage, things remodel with time. And so you'll find that maybe it resolves on its own. And for those that don't, as I said, we address it in that, in the fashion with the breast center or through us. As far as addressing a cyst and a cyst aspiration, we do that under a little bit of a local anesthetic. You basically define the area. If you've got a handheld ultrasound, as I said, you can often define the borders of the cyst. Use a little bit of a local anesthetic in the skin, but what you're doing is you're just basically, not unlike starting an IV, you're placing a needle through the skin into the cyst itself and basically aspirating and taking out that material. The reason to numb the area, of course, is not only to make you comfortable, but we usually use a little bit larger, bore needle in order to make sure that we take out the contents of the cyst. And a breast center is going to do the same and similar process. Following a cyst aspiration, once you've had aspiration, I usually wrap the patient in an ACE wrap compression dressing for certainly that evening. And then I tell them just to wrap the ACE over their bra for the next couple to 3 weeks. If you've got a cyst and it was filled with some fluid, draining it and collapsing, it's one thing. But what happens is if you don't keep the walls collapsed, the tendency is for the body to want to place some fluid back in there. Not necessarily the same fluid, but want to place some fluid back in there. The body's quite clever. When something all of a sudden goes missing, it says, hey, what happened? And it may return that fluid. So keeping it compressed for a couple, 3 weeks helps to close the cyst off.